So next we've got Dr. Ellie Jameson from Bangor University, and she'll be giving us a flash talk on phage as a prophylaxis or treatment of AMR infections.
Sorry. Yeah, so I have changed the title a little bit to fit in with this 5-minute flash talk. So I'm going to be talking today about developing phage cocktails against urinary tract infection causing Klebsiella. So I'm just going to walk you through what's involved in isolating these phages and developing these phage cocktails. So it begins with isolating our phages from the environment, characterizing them to make sure they don't have any negative impacts, and then combining these phages together into these phage cocktails and looking at the interactions they have with other drugs. So the first stage is this isolation stage. So we start off with our bacteria of interest, and then we go fishing for new phages in the environment. So a lot of the time this involves sewage, so I never thought I'd get quite as excited as I do about sewage, but sewage is a fantastic place, especially for these escapee pathogen bacteriophages. So we take our sewage, we enrich it, and then we look for these phage plaques. So thank you for Tim and Ivy for explaining about phages and their plaques. Makes this a lot easier. And then once we have our nice, diverse, different library of phages, we go into the characterization. And this characterization involves partly looking at the genomes of those phages. So we want a nice, diverse collection of phages which have different interactions with their hosts. They have different host receptors, and they work in different ways. So we screen these genomes for any harmful genes as well. So we want to avoid any phages which improve the virulence of our hosts. We want to get rid of any that carry any toxins, and we want to avoid any phages which have antimicrobial resistance. So once we have our non-harmful phages, the next stage of the characterization is checking that they're going to work in the environment that we want them to work. So this involves using different media. So we test our phages with their hosts against different media, and in these little graphs, you don't have to take in all the details, but the solid lines of different colors are the different media, and then the dashed lines are when we've added the phage to them. And what you can see between different hosts is that the same phages might work better in different media. So this red and blue here, where it's purple and green here, and then there's a lot of different interactions going on these. So when you introduce these bacteria into the different media, they're producing different surface proteins, their metabolism changes, so you want to check. And here we're checking that our phages still worked in artificial urine media. So we selected those phages which aren't harmful, which work in our artificial urine media, and then we go on to looking at their interactions. So this involves building phage cocktails, which is just combining different phages together, which helps to improve their host range, and it overcomes any phage resistance that the host might develop. So by combining our phages, this is the bottom purple line as our phage cocktail, and the red is the no phage controls. We can see that the phage cocktails are as effective as the individual phages, or they might have better combined effects than any one phage on its own. So looking for those phage cocktails which work really well together against a range of our different hosts that we want to target. And then once we've selected those phage cocktails, we want to check what their drug interactions are as well. So in this case, we're looking at antibiotics with our phages, and fortunately in this phage cocktail, we've got this interaction with meropenem that we have either additive or synergistic interactions between our phages and antibiotics, which is really important because phages are often used as a last resort, and the patients are currently using antibiotics. So we don't want any antagonistic interactions here. So now we've got a lovely phage cocktail, but that's not the end of the story. We'll want to know if we can actually use these in patients. So this has taken two different routes. First of all, we check that our phages can work in catheters, and they work in this artificial urine media. And then we move on to like the more complex biological interactions. So we introduce them into animal models which have their own microbiomes. So this involves a few different stages, and in this Klebsiella work, We worked with biofilms to show that our phages could work in the catheters against biofilms. And then we introduced flow to the system to make sure that our phages aren't just getting washed out and we have no interaction. So we can see that the phages still work when we have flow there in the catheters. And then moving into these simple animal models in the waxworms, we tested if our phages could work against our Klebsiellas. So we introduced either a phage-susceptible Klebsiella or a phage-resistant Klebsiella. And when we actually introduce it into these animals which have their own microbiomes, we saw that the phage cocktail, which didn't work in vitro, actually started to rescue these animals, and it's having some effect on that Klebsiella and helping to improve the survival of the Galeria. And this is even greater in the phage-susceptible Klebsiella. And then working with colleagues at Leicester, we also introduced these Klebsiella into the bladders of mice, and then we added the phages afterwards. And we could see when we add our phages, we get these blue bars where the phages are reducing the amount of bacteria that are in the bladder, but they're also reducing the symptoms of disease in these mice and inflammation within those mice as well. So we've got some really nice evidence that these phages should work in real patients, but getting from here and actually using these treatments in patients is quite challenging at the minute. So there's more momentum in the UK to get them used in patients, but it's mostly on an individual patient basis, and trying to get through this last hurdle of using them in patients is what we're exploring now. So I just want to thank, this is done by a lot of students and group at Warwick University, and working with Leicester University as well. Thank you.
Thank you for another great talk.